Hello, cruel world. Okay, here's an interesting question. Are patients on a psychiatric ward constantly observed? Are nurses sitting there and watching them the entire time, 24 hours a day, 7 days a week? I recently got asked this question for a newspaper article. I thought it was interesting, so here is my answer. My name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. To answer that question, we have to differentiate between the different types of psychiatric ward. So general psychiatric wards are by far the most common. When people get sectioned or when they're voluntary patients, that's where most people go. The type of wards that I personally work in as a forensic psychiatrist are secure wards. So they are for people with a history of violence. They are for people who sometimes have come from prison. And there are different levels of security within secure wards. So there's medium secure wards, which are the vast majority of these wards. And then there's high secure wards like Broadmoor. I'm sure you've heard of Broadmoor. The reason I'm mentioning this is because the different levels of observation change between the different types of ward. Having said that, almost all wards have nurses on the ward 24 hours a day. So even in the nighttime, there'll be nurses on a night shift. And they're usually in what we informally call a fishbowl. So it's like an office somewhere in the middle of the ward where it's got like massive glass windows and you can see down the individual corridors so that the nurses in there can see most of the ward most of the time. But I think it's fair to say, and if you're a psych patient, if you're a psychiatric nurse, I think you'll probably agree with me that nurses are always, almost always understaffed and really busy. So they have loads of paperwork, admin to do. They have to take people out on escorted leave, for example. So there's usually a shortage of nurses. So there's not a lot of time for nurses to literally be kind of patrolling the wards. Some wards, though not all, have CCTV. So again, Broadmoor absolutely, definitely has CCTV. Medium secure units, some will, some won't. General adult wards, depends on the type of wards, most probably won't. But despite the nurses being in a fishbowl, despite the CCTV, there definitely is blind spots. So for example, there's no cameras directly in patients' toilets, obviously. So there is not unusual for there to be some errant behaviour, some boundary breaking, some naughty. So for example, in wards that I've worked on, there's been lots of drug use, there's been some sexualised behaviour, there has been assaults. Again, just really want to stress that I work in forensic psychiatric units where everybody has a history of violence or is a known offender that's come from prison. So I'm not saying that this happens in general adult wards, but in these wards it does happen. So to go back to my original question, what's the kind of level of observation? Well, the vast majority of patients that come in are on what we call general observations. So there's usually general obs or special obs. Different wards have different names. Some wards use like traffic light systems like reds, yellow, red, amber, green, you know, the traffic lights. But basically it all equates to the same thing, general obs or special obs. General obs means that patients aren't specifically observed, but they're allowed to walk around freely on the wards and the nurses are generally observing everybody. Then you have special obs. So there's one-to-one where a nurse has to stay with that person and follow them around. So that might be if the person's at a high risk of self-harm, hurting themselves, suicide, attacking other people. And two-to-one means two nurses to one patient. And that's if somebody's very, very kind of uncontainable. So one nurse might not be able to physically restrain them. As you can imagine, this is a huge drain on resources in an already busy, usually understaffed ward. So to put somebody on one-to-one or even two-to-one obs is a headache to get the nursing staff in to do that. And then there's arm's length observation. So that's as it sounds. So it's literally that far away. So the nurse has to stay that close to the patient. So if the patient moves, the nurse has to go with them. And that is in a very, very high risk patient who is at risk of immediately grabbing something in their vicinity and harming themselves, as opposed to kind of long-term chronic self-harm. What we're talking about now is bordering on the need for seclusion. So that's a different topic. Maybe I'll make a different video, but we have these things called seclusion rooms. There's no such thing as padded cells, despite what you might see on TV programs. But we do have rooms where patients, if they're extremely agitated and dangerous, can be locked up and observed. But we use this as infrequently as we possibly can because obviously it's distressing for the individual. Okay, I hope that has alleviated some of your fears, inquiries, concerns about how psychiatric patients are observed generally in psychiatric wards. If you're interested in this topic, you've got to go check out my YouTube channel, Psych for Sore Minds. I talk about a smorgasbord of topics related to mental illness and offending and violence and the crossover between the two. I also psychoanalyze some of your favorite stars. Okay, catch you on my video. Have a blessed day.